Good afternoon. It's 4:30 p.m. here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus situation here in South Korea. We're going to very shortly cut into the briefing at the Seoul government complex, where the Health Minister Bang Nung-woo will be updating us on the situation of the coronavirus here in the country. But first, we start with news. We start with the COVID-19 situation here in the country, bringing you some updates here. South Korea has seen a fluctuation in the number of daily COVID-19 cases, but for the first time in over a month, the number has dropped below 100. Meanwhile, schools in the capital region are about to start in-person classes on Monday, and here is our Chang Tae-young with the details.
South Korea reported 82 new COVID-19 cases on Sunday, seeing the number of daily infections fall below 100 for the first time in 38 days. Of those, 72 were local transmissions and 10 were imported. The cases of severely ill patients have decreased by 6, bringing the number to 146. As of Saturday afternoon, a total of 24 cases were linked to a property developer in the Gangnam-gu district. Also, a total of 48 cases are related to Yonsei Severance Hospital, and 16 cases were tied to the production lines of Kia Motors. The government is continually advising people to stay home to stop the spread of the virus.
Even though it's the weekend, we ask you to cancel or postpone unnecessary outings or meetings to prevent the spread of COVID-19. And if you have to go out, wear a face mask properly.
In the meantime, schools in the capital region will resume in-person classes from September 21st until October 11th. For kindergarten through middle school, classes can be held at 1/3 of capacity. For high schools, it's 2/3. South Korea reported 5 new deaths as of Sunday, raising the death toll to 383. Since most of the deaths are coming from the elderly, the government is advising them to stay home. The total number of COVID-19 cases stands at 22,975. Chang Tae-hyun, Arirang News.
The South Korean government is rolling out another round of emergency funds for members of society who are reeling from the impact of the coronavirus pandemic on their daily lives. The Finance Ministry on Sunday said it is preparing to hand out the first round of income support for freelance workers, those with unstable employment conditions, and families with small children and primary school students. The funds are being prepared to boost income during the extended Chuseok holiday, to be paid out on November 28th and 29th. The government will send out texts to those who qualify to register for the payout if the fourth extra supplementary budget bill passes through the National Assembly this coming Tuesday. Flights between South Korea and Russia are set to resume next Sunday for the first time since they were banned in March. Russia banned inter-country travel in March to prevent a foreign influx of the coronavirus. But Russia has started loosening restrictions very cautiously by slowly recommencing inter-country flights and lifting entry bans on foreigners. Once the flights resume, Russia's airline Aeroflot will fly between the two countries once a week. But with COVID-19 spreading rapidly within Russian borders, resumption of flights might be rescheduled to a later date. With several cluster infections in hospitals in South Korea, those working on the front line are becoming increasingly worried. The World Health Organization even reported that 1 in 7 COVID-19 cases worldwide came from health workers. Our Tae Jong-un reports on how medical workers are coping with the situation.
Battling on the front line of the COVID-19 pandemic since March. One nurse in South Korea says the fear among his co-workers is growing due to the increasing number of infections among medical workers.
Those who are single are coping with the situation, but those who are married, have children, or live with high-risk groups are worrying about spreading the virus to their loved ones.
So far, 5 of his close colleagues have contracted the virus.
One of my fellow nurses who has a 10-month baby tested positive. She was devastated and cried all day long. She said it made her even regret becoming a nurse.
With the resurgence in the country, major hospitals, including Yonsei Severance Hospital, have seen cases of double-digit infections within the wards. To prevent the virus spreading sporadically, Seoul city government has decided to preemptively test some 25,000 hospital workers in 8 districts. Doctors and nurses around the world are facing similar challenges. According to the World Health Organization, around 1 in 7 COVID-19 cases worldwide are among health workers, and that figure is as high as 1 in 3 cases in some countries.
It's not just the risk of infection. Every day, health workers are exposed to stress, burnout, stigma, discrimination, and even violence.
The uncertainty of not knowing when the pandemic will end is causing tremendous stress among doctors. Since June, more than 500 medical workers have gone through counseling at Korea's National Center for Trauma. However, medical workers say there is a limit to what they can do, and the key solution to ending the pandemic is active cooperation from the public. 최정윤, 아리랑 뉴스.
US President Donald Trump says he expects his country to manufacture enough COVID-19 vaccine doses for every American by next April. Trump said on Friday that the US will have manufactured at least 100 million vaccine doses by the year's end. He assured that once a vaccine is approved, widespread distribution of a vaccine will begin immediately within 24 hours after notice. But many US media outlets are pointing out that such a timeline is more ambitious than what pharmaceutical companies and top healthcare experts forecast, that most Americans will not be vaccinated until mid-2021. 8 months since the first reported case of COVID-19 in the country, South Korea has built a global reputation for its massive testing capacity. The country has carried out over 2.1 million tests so far, and over time, its screening centres have evolved as well. From drive-thrus to walk-ins and walk-throughs, it's now non-contact to lower the risk of infection for frontline healthcare workers. Getting tested for COVID-19 without ever coming in contact with anyone, our Tae Won-jong tries it out for himself.
With the pandemic continue to linger, a local district in Seoul has come up with a new type COVID-19 test center with quicker and safer screening methods. This so-called non-contact test center opened Monday in the Seochogu district of Seoul to minimize unnecessary contact between possible COVID-19 patients and medical workers. The process is simple. Once individuals arrive, they're asked to provide their personal information. Next, they'll be escorted to a member of staff who will ask questions based on their symptoms. Then they will move to another room where doctors will take nose swab samples. What makes the center non-contact are the door handles, which have thermal sensors for hands-free access. Also, the staff and patients are always separated by glass, with microphones in each room for smooth communication.
Once the samples are collected, the room is disinfected. Disinfectant is spread automatically after individuals leave, and the sterilization lamp stays on for about 8 minutes before the next person enters.
The center is able to carry out up to 500 tests a day, and without need to wear heavy protective gear, offers comfortable conditions for doctors and staff.
We don't need to wear level D protective equipment anymore or work in a negative pressure room, so it's much more comfortable.
There's also X-ray room and a waiting area for potential large groups of people requiring checks. This non-contact test center will be able to help the on-site medical workers carry out COVID-19 checks safely and comfortably, even during the hot weather or the upcoming cold weather. Tae Won-jong, Arirang News.
The South Korean government has arranged a job fair online to help people find work. In pre-pandemic normal times, a company would set up a booth where they could answer questions and take applications in person. But that's all happening virtually now. Our Peunji has this report.
This woman looking for a job sits in front of a camera for a one-on-one with the company director. The director answers questions on what exactly the job is about and what requirements are needed to apply for the position.
Preparing portfolios will be helpful for online interviews. Showing this portfolio on the screen during the online interview or sending it to us in advance will help you get the job.
박지훈 교통정책총괄과장.
So we also have Park Ji-hoon and Yoon Tae-ho here from the Central Disaster Management Headquarters, and we are also providing sign language translation. First, we will hear from Minister Park Nung-hoo. So I am the first Vice Head of the Central Disaster and Safety Countermeasures Headquarters, Minister Park Nung-hoo. As of September 20th, there were 72 local community spreads, and among them, 55 came from metropolitan areas, and for the non-metropolitan areas, it amounted to 17. Yesterday, 5 people passed away. We pay our respect to the deceased and we pay our condolences to the family members. Today, it has been some time since we started the second level social distancing that we carried out since August 23rd for the metropolitan areas, and we have to decide whether to extend it or not. Thanks to the efforts of the citizens across the country, we were able to see a decrease in newly confirmed cases, and we see that it is becoming stable. On August 27th, on a daily average, there were 121 people who were newly infected in the metropolitan area, and this was the peak. However, for that past week, it has decreased to 23.7 for the metropolitan area. So it could be possible that there was a decrease because it is the weekend. However, we saw the number amounting to 17, which is less than 20. And when we look at the infection level for the past 2 weeks, it's actually below level 1, so it is becoming more stable. And last weekend, when we looked at the cell phone movement, we saw a decrease in the movement by around 30%. And we believe that we'll be able to see a continuous decrease in the newly confirmed cases thanks to that. And for the non-metropolitan area, in terms of the spread, we were able to actually satisfy the indices where we are able to lower the level 2, level 1 for social distancing. And this is all thanks to our citizens who participated actively in social distancing despite all the difficulties. We really want to express our gratitude to you. However, there are still risks, and we cannot be relieved yet. In terms of the infection, in a lot of cities and provinces, we saw sporadic infections. And even today, in areas that are non-metropolitan areas, we were able to see patients in 8 cities and provinces. And also, last week, for the cases where we are diagnosing whether there are causes or not, it was around 20% level, and there is still a risk that there could be unknown causes still existing within our cities and provinces. And even now in the metropolitan area, we still see a lot of new patients, and since we have the Chuseok holiday next week, we believe that there could be increased risk as people move around. And when we consider all of the risks in the metropolitan areas, right now it is too early for us to relieve the social distancing level for non-metropolitan areas. We have to remember that Chuseok holiday is only a week away. So rather than actually endangering ourselves, we believe that it is better to keep it because we will be able to retain the risk if we do so. So for the non-metropolitan areas, we're going to apply the same measures that we apply to the metropolitan area. So we're going to extend the second level social distancing until the end of September and beginning of October as well. So we're going to retain the measures. So for the indoors, people can only gather where there are less than 50 people, and for outside, we can only have people gathering at a level less than 100. And we're also going to prevent any gatherings. And we're also going to have spectator-less sports events as well. And for high-risk multi-use areas, they have to make sure to follow the core disease control measures. However, depending on the local governments and depending on the case of infections, we can actually have flexible adjustments be applied. So the measure will be taken until September 27th, and we're going to have a special measure for the Chuseok holiday. And for the special Chuseok measure, we're going to see how things go, and we believe that this will be an important waterfall that will determine what will happen in the time period afterwards. So we're going to announce any specific measures, and we're going to make sure that we take pan-governmental measures as well. And afterwards, we're going to also strengthen social distancing afterwards, and we're going to receive the opinions of the experts and government personnel to announce the specific measures on it. Now we're going to talk about the special measures for Chuseok holidays. Based on the research of the Traffic Research Center, for this Chuseok holiday, we believe that the movement will decrease by around 23%. In particular, we believe that a lot more people will be moving through their own vehicles rather than taking public transportations. And in order to contain COVID-19 in the Chuseok holiday, we're going to strengthen the policies and guidelines on disease control. And for rest stops, we're going to be monitoring them very closely. We're going to split up the entrances and the exit of rest stops, and for all food items, you can only have packaged food items. And for the outdoor tables, we're going to have transparent barriers in place. And also, in terms of the highway traffic, we're going to retain the toll fee as it is now, so that we can actually contain people from using the highways. And also for the tolls that we collect, we're going to use it for public uses such as COVID-19. Railways, terminals, and airports. For these traffic areas, we're going to retain the highest level of disease control. And for railroads, we're going to limit the passengers to 50%. And for the trains and planes, we're making sure that people can only sit on the window seats. And for the Chuseok traffic, in order to make sure that we are able to succeed in terms of disease control, we also have to make sure that you take and comply to the measures in a voluntary manner. So please refrain from going home if you can. And if you do have to go inevitably, please make sure that you follow the strict rules on disease control. And if you're moving by your own vehicles, please make sure to prepare food items and water so that you can minimize your stay at rest stops. And if you're using public transportation, please make sure to wear a face mask at all times and refrain from talking. And also in preparation for Chuseok, we're also going to support and strengthen the disease control measures for traditional markets. So starting this week, we believe that a lot of people will be visiting traditional markets in preparation for Chuseok. And until September 27th, we're going to impose it as special Chuseok holiday and strengthen measures in the traditional markets. So to our citizens, well, we always ask you to wear face masks when you go to the traditional markets. And we ask you to participate in terms of disease control as well. And for traditional markets, in order to promote online sales, we're going to make use of the post office online malls and other malls as well. And we're going to be selling the regional items at a discount, at most 40%. And we're also going to promote the use of mobile gift certificates. And for this Chuseok holiday, if you make use of more than 500,000 won worth of the onnuri 상품권 online, we're going to actually give you more points so that you can make more use of it next year. Please make sure to refer to the press release document for more details. So this is the first holiday that we are facing since COVID-19 outbreak. So we believe that you really won to be able to sit together with your family members and have good conversations. However, this time around, please refrain from doing so because it could put yourself at risk. And especially if you have elderly patients, please refrain from moving around this holiday and please make sure to stay at home where it is safer. Until now, with social distancing, you may not have been able to visit your family members, and we really want to apologize to you for that. However, our future really depends on how we spend our holiday, and this will actually determine how we're going to spend our fall and our daily lives as well. So you remember how last holiday gave us some difficult times, so please make sure to remember that. And we also ask the citizens, and especially to the metropolitan area residents, please make sure to refrain from having contact with others and stay at home if you can. Please make sure to not go out unless you really have to go out. And please make sure to refrain from having any gatherings or outings. Thanks to your concerted effort, we are seeing a stabilization in the outbreak of COVID-19. And we don't have much to go in order to meet our targets. The government will also make efforts so that we can recover our disease control measures as well, and we're going to also strive very much. Thank you.
지금부터 질의응답 시간을 가지겠습니다.
That was Health and Welfare Minister Bang Nung-ho briefing us on the COVID-19 situation here in South Korea. And that does it for our coverage of the briefing this afternoon. We will be back there at 6 p.m. Korea time with our regular weekend news. Bye for now.